All right. Hi, guys. Thank you so much for tuning back into the Smile Project podcast. Today, we have another award winner, and he won the Distinguished Performance in Clinical Case Management. And he actually presented two multidisciplinary cases. One of a 34-year-old lady with dental trauma, of which the treatment includes extraction, root canal treatment, and cantilever bridge. Another case was a 9-year-old with underlying cerebral palsy and construction of an upper removable appliance for an anterior crossbite correction. So let's bring him on, and I'll let him introduce himself to you guys.
Hello guys, I'm Zhai. So I just graduated, and also now I'm working as part-time dental assistant.
All right. So Zhai, let's just get right into it. So can you just share about the cases that you did?
Okay, so actually the first cases was a trauma case. So it was a young lady and come in with a fractured tooth after having a fall when she was playing badminton. And she was in intense pain, and the fractured tooth was non-salvageable. So yeah, in the first visit I extracted that tooth, and also one of her, the one that I extracted was actually a lateral incisor, and then one of her central incisor was tender also during the examination. So after that, the interesting part was actually that central incisor has slowly progressed to develop external root resorption, as I think it was believed that it has some laxative injury before during the trauma, during the fall. So yeah, before this, it took me like almost 4 months of review to finally come to this diagnosis after all the PA and also the CBCT.
All right, and PA is the periapical radiograph, right?
Yeah, periapical radiograph. Yeah. In the beginning, right? Yeah, to be honest, I was quite clueless on what I should do lah. Because although we have studied all the management of those lesion and also all the disease before on the textbooks, right? Yeah. But then at that moment when I got the case, my mind was just went blank for a while. Yeah. And then it was actually, this is my first root canal case in my clinic. So I immediately seek help.
In your undergrad, this is your first root canal case.
Yeah, then I immediately asked help from my supervisor, and then asked for their advice, like what should I do. And then after seeing the radiograph, right, they further confirmed the diagnosis, and then they asked me to start root canal on the same visit.
Oh, okay.
Yeah.
And so tell us about how you managed all these cluelessness for the case, besides consulting your supervisors. Did you go back and read, or what else do you do?
Yeah, of course at that moment I can't really do much recalling what I've learned from my textbooks, and then try to follow my supervisor instruction, and then did what I can, try my best lah. Yeah. But then after that visit, I go back and then I try to do some study on it, like what is the diagnosis of this, and then what I can do, how I should manage it, and then
And you did the root canal treatment, and what happened after that? Was there anything that you had to be careful of?
Actually, the RCT was almost the same. The management concept is almost the same as the other RCT, but then it add a little bit challenge for me because external root resorption, and then the canal were actually connected to the PDL space, like there's a lateral canal like that. So it adds some challenges for me when I'm obturating it. So, but actually the general concept was still the same lah. But then to stop the source of the infection and also remove the source of bacteria, something like that. Yeah. But it's slightly different from normal RCT. Like for example, in this case, I've used corticosteroid plus antibiotic paste such as Ladamix to stop the resorb cells first. And then after that, I used the calcium hydroxide for many visits because it's always the gold standard for the intracanal medicament for such case. after I've read up and do some research for external root resorption. And then I remember that I've read some article saying that to place the corticosteroid and also antibiotic paste every 6 weeks until the resorption has not progressed. And then after that, we can followed by the placement of calcium hydroxide every 2 to 3 months until there is a hard tissue formation around the resorption, around the defect, basically. And then only after that we can proceed to the root canal filling part. So yeah, for that moment, I really think it's quite challenging for me, especially it was my first case also. Yeah.
Great. I think you managed it. I think you managed it well. And how was the patient after all this treatment?
Actually, for the patient still, like, because I recall the patient for many times, like throughout the whole treatment, I think it's around more than half a year for just one root canal treatment. And then initially the patient still having pain and then like slight tenderness on that tooth. Even I have changing the intracanal medicament each time, like each recall I change the intracanal medicament and then do a lot of irrigation, all that. But then patients still come back with pain, still slight tenderness, yeah. But then finally it was asymptomatic before I operated. I did recall her twice before I graduated, and the radiograph did show some sign of healing. Actually, before I proceed to the definitive restorative, that is cantilever bridge, doctor did advise me to wait until there's sign of healing, only we can proceed to the fixed prosthesis. So yeah, we actually wait for a long time before we actually fabricate the cantilever bridge. So yeah.
What do you think is a take-home point for this particular case?
What I think is like for this case, right? Okay, like for this case, I think what I learned is that diagnosis is the key point. Like it's a crucial part that decide how you are going to manage it. Because if your diagnosis is wrong, then of course your management will be different. So I think the diagnosing part is very important.
Yeah, very well said. All right, and for your second case, maybe you can share with us what was your case about, because I know it's about a 9-year-old with cerebral palsy, and you did removable appliance for anterior crossback correction, right?
Yeah. The patient actually has a history of cerebral palsy when she was an infant, during her infancy period. But right now, she only has a muscle weakness on the upper limbs. Yeah. But the more concerned part, the cerebral palsy actually doesn't really influence and affect her daily life. The more concerned part for me is she actually has an episode of seizures in between her dental visits. Like I remember one recall, and then the patient didn't show up, and then I called her mother, and then her mother said because she can't attend to the review because she had seizure before, and then she get admitted to hospital. Yeah.
I see. From this case, what do you think you would like to share? What's the highlight of this case?
I would say the medical history was very important. Like even this was just a simple malocclusion case, and this is just a removable appliance case. But the medical history of that patient will further complicate the treatment, I would say. Like because I'm issuing this removable appliance for her, and then this patient actually has a history of seizures, like just few weeks before the issue of my appliance. So there's a risk that the removal appliance might getting displaced if the seizures happen in the future. So yeah, I was alert about this point. So like the medical clearance must be needed from her physician before I issue the orthodontic removal appliance to her.
Oh, okay, that's great.
Yeah.
So you actually you actually had clearance from her physician before you actually did anything for her lah.
Yes, correct.
All
Yeah.
right. I think it's very important to keep our patients safe. I think that's very important to actually practice safe dentistry, and we involve the parties that is needed to be involved. And in this case, is the physician. You needed the clearance from the physician before actually giving the patient her orthodontic appliance. So, what advice can you give to probably undergraduates that are in clinics? They are practicing in the clinics already. What do you think is one advice for them to actually manage their cases?
My advice I would say is try to be responsible on what you are doing to your patient, and also what you will be doing for your patient as well. And also do not be afraid to ask any question when you have any doubts. Some of us will think usually we should have already equipped with all the those clinical skills and also knowledge during our lecture or what. But there are many other lessons that we can to be learned, and also is built up from our experience lah. So just like the two cases I mentioned just now, it seems like a bit straightforward case, but when you look closer, you have something else to take note and to be alert of. So yeah, whenever we feel something uncertain or unfamiliar with, it is very important and not to be shy to reach out to others, like anyone around us, our supervisor, senior, or even our own colleagues. Ask some question lah. I believe they will definitely help us. Yeah, and then from that, we will be slowly improving ourselves.
Yeah, I think that what you said is very important, to actually be responsible to the people that we are actually handling. And it is true that in clinics we are not alone, right? We have our supervisors, we have our peers, we have our partners, we have nurses, we have a lot of people around us that actually are willing to help us. And thank you so much for joining us today. I think this comes to the end of our interview, and once again, congratulations for winning the award, and we really wish you all the best. Thank you, Zhai. Bye.
Thank you, Rikan. Bye.
All right. Thank you guys for tuning in for another episode of the Smile Project podcast. We'll see you on the next one. Bye.